The Global Allergy and Airways Patient Platform believes we can all live better. Do you seem to cough all of the time? Do you feel like you can't make it stop? In just a few minutes, we'll help you learn what you need to know about chronic cough. We'll look at an overview, symptoms, and treatment for chronic cough. Chronic cough is a persistent cough that lingers for more than 4 weeks in children or more than 8 weeks in adults. Chronic cough is often triggered by a viral illness, such as the flu, or may be associated with conditions like asthma, sinusitis, or postnasal drip, and at times from gastroesophageal reflux, commonly known as GERD. A chronic cough can negatively affect people's quality of life. Fits of cough can be exhausting and may get worse with losing sleep. Chronic cough may cause people to avoid public gatherings or transportation, leading to social isolation and depression. Severe coughing may also take a toll on the body, including rib fractures, urinary incontinence, and passing out. Risk factors for chronic cough include smoking. People who have smoked at least 100 cigarettes in their lifetime have a doubled or tripled risk of chronic cough compared with non-smokers. Use of medications called ACE inhibitors. These drugs are used to treat high blood pressure. If you are experiencing chronic cough and take this medication, your healthcare provider may prescribe another medicine for you. Environmental or air pollutants and secondhand smoke, which is living with or spending time with people who smoke. Working or living in certain places can cause more exposure to airborne foreign objects or particles and toxic chemicals. Discussing your symptoms with a healthcare provider is often the best way to diagnose chronic cough. Then together you can look for its cause using various tests. Diagnostic testing can include lung imaging. X-rays or CT scans help diagnose some of the causes of chronic cough. Lab work can identify signs of inflammation or allergy in your blood or phlegm. Lung function tests can identify some diseases like asthma or COPD. The most common test is spirometry, often used to diagnose COPD and asthma, but you also may be sent for lung volume test or diffusing capacity test. Tests using a scope that involves a tube. This will include inserting a thin tube with a lightened lens in the nose or mouth. A biopsy can be taken from these places to check for abnormalities. Skin allergy testing. You can help identify your coughing triggers. And cough monitoring to track chronic cough. Devices or apps developed as tools that can help you, your caregiver, and healthcare provider manage your cough and understand the best treatment for you. By monitoring changes in how often you cough and how hard you cough, treatment can be adjusted to best fit your needs. How is chronic cough treated? There's medical treatment, which includes treating the underlying cause, if known, and that may improve or cure a chronic cough. There is no medication approved for chronic cough related to unknown causes. Your healthcare provider may recommend over-the-counter cough suppressants, but they are not recommended for chronic cough as there is little evidence that they actually work for this. Opiates. Current treatments for chronic cough involve opiates such as codeine, morphine, or diamorphine. Opiates must be taken only when prescribed by your physician and in the right dosage as directed. Airway clearance techniques and devices help clear out the mucus or phlegm. Home remedies may include drinking enough water and staying well hydrated, using air humidifiers for dry cough, mint lozenges or tea with honey that may ease symptoms, and lowering your risk, reducing your exposure to smoke, pollution, and toxic fumes. Speak to your healthcare provider about quitting smoking or joining a support group. If you think you have chronic cough, please see your doctor. If you have chronic cough, be sure it's being treated appropriately. GAP believes in empowering people around the world and wants you to live better. For more information, go to gap.org. The mission of Global Allergy and Airways Patient Platform is to globally support and empower patients with allergies, airways, and atopic diseases by protecting their rights and insisting on the duties of governments, healthcare professionals, and the general public. Thank you for listening. Join us for more Gap Notes health presentations.